And all eyes are on doctors and nurses at the Akufo-Addo Teaching Hospital in Kumasi on whether or not to resume work over the suspension of the hospital's CEO after directing the temporary shutdown at the Accident and Emergency Center. Well, just yesterday, the Health Ministry released a statement defending the 2-week suspension as it insists it is an administrative measure aimed at facilitating an independent investigation into circumstances surrounding the temporary closure of the 37-bed capacity facility. Well, the ministry has appealed to the health professionals to resume work as scores of patients at the hospital's outpatient department are left stranded seeking medical care. My colleague Emmanuel Bright-Kweku was at the hospital where patients are stranded and came through with this.
Kakra mami.
Oh, issue kakra. Ya na de kakra woni yam. Ana de baji be yan hwehwemu binti. Yenke be hu gynecologist na ya further information be we kan ba ha twice. Ya ba the last time ya ba ya kire say doctor no be hwe no abuku awie nti ate se ban ene nso e bedru ye no say damna omo strike binti ate se next week nti eno an ye nyina omo egu ha nyina eno anti na egu ha sei
nti u kofi ana
o say kofi
den omo ka chewo minim se omo ya announcement bi
omo say ate se doctors na sa back to work na ya ba yente ya yentire fie to say beti so omo astart adwuma ansana ya ba fie
mommy minim se ona oha no una wo yare send them out feel say wa ba strike ekoso
sir yare na nti na me ba ye nso me ba na mo so mo koso akinti ye nkofi ekopem tama ye beti se o ma bansa na yaba nti efi ana me ko
no say no yare no say ha wana
say na ha me nso ma ya ne dan say aba ne santi.
And that's it. So that's some of the patients here. Mommy also brana me no ndin komo menim say na o ma me ansa na ye ba camera is go patch up be me kakra na o che me say o fi baby na ba hemfa na o fi bai
patch up free German North
hemfa sampa
asu oko
ai ben sampa na
ben sampa ye ne sampa nyina ye area ba ko na yare ya bo me na omode mba ha sei enti ba mfie nsie ne ha ya na me ba bosumi mienu nka sese kura de omo aboa ye se obehu doctor na ye de yenuro na akosi sampa na makwa akwaje nti edi bosumi nsia na mabehum doctor na wa hwese de ya de na akwa akoduru enu ameda ha o ahemachi no na ye ba ya omo se nsensem bi wo ha nti no ye ntra se ntwa na ebobo 8 no ye benya muaye ye de ka de akoto ho eti boy ya antihwe no nkura boy ya antihwe ekobotan na omo be boy amane se omo ko meeting nti ada se doctor no be ba be hwe yen so me hwe yen de omunim ene ye de ti ha ye o
to ba hatambe
me be da ha nura
no na no pa no be ko diki 4
o'clock ke se wa mantema o doctor no card ni be di akire me so mfiri ba bi na aba se si ya me ka say se doctor amhwew na so mama o date kura wo nkwa ne se wo mra no ka ska kura 2.1 ansa na di obedi ansa na dura obeto enka doctor yi wa de ewo brekum ni de ewo sunwan ana sampa aye mfidi ewo ji ha no se nka bi wo ye ho a ena nka ho doctor fo no so hwe ye na enka ya mape so ha ntiti se de titi se wanya dura na che se wo kwa akowunu no wa hu nti e fati timpa no kwasem ni eto da kura kaska de beba no wo be bransa na wanya na wabehu doctor na so ba na be fati ti sei mu a ukodru kaska be na obesan dia ba bie ma baji wadru ana waba be hia doctor wa ye wa ho kirem pa ye na ye wa kiri no ye wa ho kirem
mommy me da se pa bompa se ombeshemu na monyina mako. All right, and so that's a woman there. She says that she had come all the way from German North to the Akufo-Addo Teaching Hospital, and if I should give you a picture of where she is coming from, I don't know mpacho also person here din komana o ka omo ba jaya resawa hana o den omo ka chewo ho
me ba e omo se mpani hono me unfa won me ba
omo se wo sheki kra den e yo
omo se malaria omo testing me but results ni am by but doctor na share me no say Ebia malaria ewo mi moje.
Ehaya no mo hwe wa na.
Ya.
Akọ no mo se den sisi an mo kan den na cho.
Omo twe me blood say omo the results be baba timatina ho a.
Tambe na otena.
Me ba 630 something.
Na watena still no mo hwe.
Omo
match blood no but also ko hu doctor.
Ba me boy so mo se doctor ni ho no mo beba.
No mo ka say ntisi a wo kwan o ye den sisi a.
Obi ba be hwe me na me manipulate direction amanaba. And so that's also another lady there. In fact, this has been a frustration for quite a number of the patients that have trooped here to the Akufo-Addo Teaching Hospital seeking care. In fact, they say it's all about the suspension of the Chief Executive Officer of the Akufo-Addo Teaching Hospital. And we have indications that yesterday there was a meeting between the Ashanti Regional Minister, that's Dr. Frank Amakohene, and leadership of the Akufo-Addo Teaching Hospital doctors and some of the nurses. In fact, they had actually joined the strike as of yesterday, and so there was a sort of meeting, a crunch meeting with them to find a positive or a resolution to this matter. But as of yesterday, when we received the message or the communique from the Health Ministry with regards to all this situation, we do not know if the doctors are going to call off the strike as soon as possible, as being appealed by the Health Ministry, and we cannot tell. But really, the impact here on the ground is that many of these resident patients that have actually trooped here to the hospital are finding it difficult accessing care, because the nurses here have told them that until they are given a directive from above to attend to them, it will be difficult for them to actually have them go through all the medical attention that they need here at the hospital. And so over to you in the studio. My name is Emmanuel. Bright Kweku.
Well, thank you, Emmanuel. So that's the situation on the ground. We've also been hearing from the chairman of the Akufo-Addo Doctors Association, Michael Lead, who has justified the ongoing strike by the health workers, emphasizing that government was fully aware of the hospital's dire situation long before the suspension of services at the Accident and Emergency Center. He also dismissed the Ashanti Regional Minister's lack of awareness as completely inaccurate. Speaking to Love FM, Dr. Lead noted the Regional Health Directorate and Hospital Board, which included the Regional Minister, had been repeatedly included and briefed in prior meetings about the hospital's critical conditions, making their shock and punitive actions appear not only uninformed but reactionary.
With our engagements with the Akufo-Addo Board and then the RCC, what we get is the fact that the board, if the minister says the board was not aware of the decision, and then the RCC wasn't aware, I mean, that is.
And I picked up some information also on late Friday evening that says that even before that statement from the hospital signed by you came out, that you were suspending admissions of patients to the accident and emergency, the regional minister was in the room, true or false?
Yeah.
He was in the room.
Yeah.
Through a letter?
No. So let me start from the beginning.
Okay.
Akufo-Addo is almost always overwhelmed, and I've reached out to a lot of friends in the media to really take a look. Any decision you take, let's say as a CEO at that point, he had operated for almost like 8 hours or so. The board members were called to see what was happening. So what was the decision? All the stakeholders, the emergency physicians, the regional health administration was informed. And there are minutes to that meeting where almost all the hospitals within the Ashanti region were contacted to how best we can solve this. From the meeting, we realized he was in the room. Okay. He was aware.
And the board was also in the room.
The board was.
So how come then the board was directed to serve that with the suspension for 2 weeks?
So when we met the board, yes, I think the regional minister, the minister oversees the activities of the board, and the board appoints Dr. Akufo-Addo. And in his accession, in the minister's accession, Dr. Akufo-Addo had heard. So that is why he was authorizing the board under we quoted some act to give him that suspension. So for us, it is, yes, what the CEO, the decision taken by the CEO together with the regional health administration, it's not a breach of, it has not breached anything.
Well, now, looking at this statement, for example, it talks about the fact that dialogue is the way to go. So, point 8 says the ministry acknowledges the concerns of staff and emphasizes that dialogue and established dispute resolution channels remain the best path to addressing grievances. Would you say that you have adhered to this?
So, I'll first of all throw that question to the minister.
The minister, you mean health minister?
The health minister,
okay.
Yeah. So, if he's indeed really the leader he wants to be, a leader who is for both the staff that provide services and for the patient. Yes, we have written that, in fact, we wrote to the board and copied you, that this is what we think. If he thought dialogue was the way to go, what prevented him from
dialoguing with you?
With us, down to go to the Labour Commission. Because, of course, he's the employer. You see, every day you are in a house with your child. Your child offends you and you go straight to the police station. No, you talk to the child first. So I don't get where this dialogue thing is coming from.
Well, the Ashanti Regional Coordinating Council has also issued a statement wading into the strike by the health workers at Akufo-Addo Teaching Hospital, calling on them to return to work. Here's what it says. It says, "Dear staff, I would like to express my sincere gratitude to all the staff of the hospital for your show of solidarity with me during this period. I am grateful for your support. However, I need you all to return to work in the supreme interest of Ghanaians and our valued patients. Whilst I defer the outcome and directions to the supreme wisdom of the Health Minister, Minta Kando, and the board of the hospital, I remain committed to the cause of President John Mahama." This is from the suspended Chief Executive Officer of the Akufo-Addo Teaching Hospital. By the CEO who has been suspended. We can now bring you the statement released by the Ashanti Regional Coordinating Council. That's the statement there that you see on your screen there. Well, it says that the real issue requiring urgent attention is the congestion at the Accident and Emergency Center, which continues to place enormous pressure on healthcare delivery and patient care. Unfortunately, this critical matter appears to have been sidelined. Accordingly, these are their demands. There are three. It says immediate review and reversal of the suspension of the CEO of the hospital, immediate cessation of any directive for the hospital board to investigate the hospital's public relations officer, and the urgent attention should be given to addressing the congestion at the Accident and Emergency Center. So that's the statement that has been released to that effect. Let's get talking and go to the telephone lines right now and speak to the ranking member on the Health Committee and also the chairman of the Health Committee. Both men are joining me right now. Let me begin with the chairman of the Health Committee, Dr. KATH Nwani. Welcome to the program. This has caused a bit of an issue at the Akufo-Addo Teaching Hospital. Our colleagues there tell us the patients are being turned away due to the strike, which has been embarked upon by the doctors in response to the suspension. First of all, let me pick your initial reaction to all this brouhaha. Hello, Dr. Nwani, do I have you? Right, we're trying to connect with the chairman of the Health Committee, but I have Nana Ayu Friye, who is the ranking member on the Health Committee. Welcome to the program. What do you make of all that is happening at the Akufo-Addo Teaching Hospital? First, let's start with the suspension of that hospital's CEO.
I think a very good afternoon to your listeners. Yesterday, I have extensive session on the probe on your network, and our views, my views reflect that of the minority. We are opposed to any attempt to blame health workers or scapegoat them for issues that is not controlled by them. Those who control the budget or control the purse have all it takes to decongest, to set in motion the hospitals in the Ashanti region, like our Priory Hospital, 500 bedded, very ready to take. They are waiting only for ECG and some little payments to contractor to start operating. Also, Syria is about 250 to 300 bed facility. It's also ready. Already, I hear robbers are taking assets, and it's battling robbery all over. It has all this equipment to start operating. And suddenly, we are faced with all this. You have Agenda 111. You heard the woman speaking that she's coming all the way from Sampa. The essence of Agenda 111 is to get hospitals with A&E, staff accommodation, state-of-the-art equipment situated close to people, so they don't need to come all the way to Akufo-Addo. You saw she has to come at 4 a.m. to sleep. And if your mother was that, if your sister was that, if your relative was that woman, you wouldn't be happy. So really, just like government is pushing a big push, 70 billion, they only need 20 billion to take care of all the hospitals in the country. But I think there's no priority on the part of government. So they don't have to blame or scapegoat to the health workers. Nonetheless, we are only appealing to the health workers that life loss cannot be reversed. And we will be very happy if they call off the strike, because we know they are right. We know they are faced with difficulties in executing their work. We know they are overwhelmed with their work. We know they are over-admitting, and we know they made sense of the situation. But nonetheless, we can't say we would continue to not the government. I mean, I have no remorse or I'm not sensitive to anything they are going through, but I'm sensitive to the public. Just holding the public to ransom, just where people will lose their life, just where people are stranded. And many of these, if you go to hospital, almost 60% are women seeking healthcare. And these are people we are sensitive, our mothers, our sisters, and we cannot afford this. I don't want to use your interview on patients to be more of emotional appeal to us. You also have to be sensitive to continuous talking to government authorities to see to the need to operationalize Agenda 111 hospitals and also to invest in them. I'll be very happy if your FM will go around the country to let us see the abandoned facilities and not necessarily interviewing patients for us to feel a sense of them to open the facility. There again, they can open the facility. It will be full again today, and the same situation will be visited. So on the immediate, I would agree with your line or your trajectory, but I don't think that is what we have to do. A taxpayer's money under MPP is a taxpayer's money under NDC. A taxpayer's money under NDC is a taxpayer's money under CPP. It has no coloration. It's the Ghanaian taxpayer, and then we are going to pay for it. So please, let us lift the argument to get government to be sensitive to the many facilities over there that can help to decongest the tertiary centers, and they are not listening to it because of political reasons.
Don't go yet. Let me bring in your colleague on that particular committee. He's the chairman of the Health Committee, Dr. KATH Nawani. Dr. Nawani, welcome to the program. As a chairman of Parliament's Health Committee, what does your committee make of the situation at the Akufo-Addo Teaching Hospital?
Let me say good afternoon to the viewers of Joy News. I say that the development at the Akufo-Addo Teaching Hospital is unfortunate. Something when it started, I thought that it's an easy situation where the hospital wanted to redirect patients. And later on, I heard that they stopped emergency services. And further and further and further now, we are talking of the suspension of services. to Ghanaians. So it is quite unfortunate that we've gotten to this stage and now call for cool heads. That is, the Ministry of Health should sit down with the teaching hospital, with a board that they have directed for the implementation of the suspension of the CEO. They should sit down and talk things over and let us see whether they can break us some peace. Because in the long run, whatever is happening is the ordinary Ghanaian that is suffering. And the patients are the victims of whatever is occurring.
Right. Well, we've been hearing a lot of commentary on this particular developing story. Some argue that this is a deliberate attempt by the striking doctors to make the minister and by extension the government unpopular. Is that a sentiment you also share?
I must say that intent and outcome might be different, and I'm not a communication expert, but the message that came out, even though the intent, like I was saying, redirecting patients to go to some other hospitals. And last week I was at the Akufo-Addo teaching hospital when they spoke about mentorship of hospitals. And I thought initially that if they redirect patients and they are ready to mentor the institutions, upgrade the skills of practitioners in those institutions, then eventually there will be increase the capacity of the healthcare system to take care of emergency situations. And I actually thought that was the way that it will end up being for the few days that they might not be able to take patients, because as I understood, their capacity was 37 and they were already at 61, which means that they have exceeded their capacity by almost 100%. And so the intent did not suggest to me that they were playing politics with whatever they were doing. I must confess that that was not what I understood.
Right.
But now the outcome is looking so different, and we are talking of a different story altogether. And that is why I'm saying that, the board of directors, the minister did not refer the case to any other person, but the board of directors of Akufo-Addo Teaching Hospital with experienced personalities on the board. I expect that they should be able to sit down with the Ministry of Health, sit down with the Akufo-Addo Teaching Hospital, and negotiate something out. Because, like I'm saying, in Ghana, we must allow the institutions to work instead of always thinking about politics and interpreting everything as politics. We must allow the institutions to work.
Right. The operating style of the sector minister, KATH, has been called into question, especially by medical practitioners. You are a medical doctor yourself. People are saying that he acts like he always is performing based on what he sees. He storms hospitals, and then there are knee-jerk reactions that happen, and then it results in chaos at every health facility that he visits. Examples are the Tamale Teaching Hospital, the Kolebu Teaching Hospital, the Akufo-Addo Teaching Hospital. Do you think that the KATH should be re-looked at, as some are calling?
of the Ghanaians that we represent, the grassroots. It is a bipartisan committee, and we will give it a bipartisan approach. That I believe that both sides of the equation will be ready to probably listen to us. If not even accept us, but listen to us and see whether we can make sense out of it. I don't want to be judgmental at this stage.
What options?
I don't want to say that the Confederation Teaching Hospital they are wrong. I don't want to say that the ministry is wrong. I only think that there is a communication gap.
What options are on the table for the health committee? Because you say you might intervene if the matter gets out of hand.
Indeed. The past days, or the past 1 or 2 days, we have been following it closely as a committee. And we have been watching what the board, the Confederation Teaching Hospital Board, what they are going to come out with, and to see whether that can lead to a solution. Yes, but we are actually becoming impatient. I must say, and it could be just a matter of days before we step in. But we are with the theory of separation of powers. Yes, we should allow the executives, to do their work, and to also be able to settle an employer-employee relationship that has gone bad.
Right. Mr. Chairman, don't go yet. I have your colleague from the NPP side, Dr. Nana Uefrie. He's the ranking member on the Health Committee. Nana, glad to have you back once again. You've been listening to your chairman on the Health Committee saying that your committee might be forced to act if nothing substantive comes out of all this that we are witnessing. What options and what advice would you give to the chairman of the Health Committee if he consults you about any possible intervention?
Yeah, my brother, I've been there before. I was a chairman when Akando was my ranking. So Akando's Rambo style approach is just what he used to do when he was in opposition. So you were asking the chairman to speak to it, but he was hesitant. Maybe that is a revolutionary KEDA PDC approach to issues. So, Mr. Chairman, you are part of them, so you will struggle. To help you, basically, we will think that there again, they are no more in opposition. And therefore, the health workers would have to be approached in a manner as the minority has prescribed, a way that brings that sort of positive energy between employer or between the minister and between employees. Again, if the chairman will struggle on this issue, I will build him up again, Mr. Chairman. If you would divert your mind to the committee platform, you will see that the minority is sharing ideas to you on the platform as we speak on how to work together to appeal to the doctors to call off the strike. There again, we've had the cooperation of the minister when he was a ranking member, where we had to work together to call off some strikes. I was his chairman. And so a good turn deserves the other. At this point, we would want to lend it the same way that at those days when I used to appeal to him, we have to work together to call off a nurses strike action. We have to work together to call off a lab strike action. And I will exercise that good faith again, like I did last year for them. I'm sure this will not be a normal practice, because we can't cross into next year thinking that you have the understanding of the minority. Again, we are sensitive to the plight of Ghanaians. That's most important. Ghanaians are the people we are feeling for. And doctors hearing me out. The ranking, I'm a doctor, the chairman is a doctor. We've gone through the same situations as you have all going through. What we are saying is that there is no problem that cannot be solved. But again, we cannot use this instance as a means to drag to a limit that the ordinary Ghanaian will feel the heat. And again, life lost is irreplaceable. So GMA, Doctors of Kofa-Noche, minority has invited the majority in a conversation on our platform to be able to visit Kofa-Noche, and then we are able to speak to them. And then I think that just as we were able to do last year with the nurses, where the minority extended the olive branch to the majority, we will be willing to do that again. But like I said, you will not expect us to continuously be reasonable, because you must also be responsible for the mistakes and the challenges, and be responsible for your own promises. You promise Ghanaians that when you come, you are going to fix the healthcare institution. You said that you were going to get Agenda 111 through. But when you came, you have all it takes to apply the money the direction you want, and you are using 70 hefty billion into roads up to 2028, forgetting that you could have just used 17 billion to complete the hospitals across the country. That will leave us with 6 new regional hospitals. That will leave us with 2 new psychiatric hospitals, a renovation of the Accra Psychiatric Hospital, and about 104 new district hospitals, which are equipped with accident and emergency centers and staff bungalows. Right. When you do this, you are solving the issue of the unemployment in the sector, where many of the young ones are looking for employment. So Ghanaians listening to me, minority is saying that, yes, indeed, the doctors were right. Yes, indeed, the suspension of the CEO has to be lifted. But whoever is related to a doctor, whoever is close to the union leaders, what we must let them know is that we can't continuously drag this strike action merely on the position of suspension of the CEO. Right.
Okay.
Yes.
Now, it appears that the approach of the sector minister, Minta Kando, has divided opinions. You've just touched on it, that this is how he was even as a ranking member on the health committee. But
yeah, because that one is the PNDC right. approach. So
but some will also say that gets the work done, because if with great power comes equal responsibility. So if there's an issue at the Kofa-Noche Teaching Hospital, the first point of call has to be the person that heads that facility. If he is told to step aside, others will argue it's not really in order.
I said on your network yesterday that it is not as if the minister has not applied what the law says. The law says in 525 that at 525, he is able to, through the board, take any decision, and that's what he has taken. Whether it's inaction or action is a policy, and he has influenced it appropriately. But then what we're saying is that legally, not everything legal sometimes is morally right by us as by Abraham Lincoln. So what we're saying is that the situation was a moral situation. However, the CEO also, I think, should have been minded, should have been really cautious of the fact that he was employed by the president.
Okay.
And it's the same president who came out and told them that you don't have to turn away patients. Okay, so my understanding of this logic, the CEO technically have acted in a very logical manner. However, the one who appointed you also gave you an instruction. So here, the CEO, before he asked for the suspension, could have reached out to the minister for a direction. My brother, are you there?
I am.
This is a case of dog by dog. These are internal NDC people appointing their own people, and whoever person they have appointed, they have the authority to appoint and disappoint. And he should have known that the president's speech in public policy is a major policy statement. When he says yes, it's a policy statement. When he says no, it's a policy statement. So he should have known that if the president has stated that, then he should have verified from the minister that this is the management decision, your direction, sir. I think he did not do that. So there again, they have their own internal issues. And like I said, this is a case of a dog bite dog. I will leave the NDC and the appointees to handle their issues. But your issues should not affect the Ghanaian.
Right.
It shouldn't affect the Ghanaian. So yes, they will have a means of tackling their own issues. I'm not part of Chairman, I'm not part of your party, and I will leave you to handle your issues. But where it borders on public resources, the lives of people, and my responsibility as a ranking member, my advice at this moment is that, yes, lift the suspension. 2, doctors and solidarizing health workers, regardless of what the situation is, we would have to go back to work. But then continuously seek what is right.
But others will also argue that the lifting of the suspension will send bad signals. It will embolden leaders of other health facilities that, okay, if we do this, it's going to turn political and eventually we're going to stay at post. Don't you think?
My brother, the ability to appoint and disappoint is not with me.
Okay.
At this point, what I'm saying is that my government, when we came, the NDC left their flagship project, the NMS project. Dodowa was operationalizing. We completed Kumewu, we did Formina, we also did the Takrade housing projects, we did everything, we completed everything for them except for Garu, Abetifu was suspended, and we converted the rest of them into Agenda 111. At this point, my interest is that if indeed we are aimed at attaining what is called the universal health coverage, where healthcare is affordable, accessible, available for all the vulnerable populations, deprived areas, what we have to do on the immediate, with the president preaching health sovereignty, he must take advantage of the health sovereignty to provide an absolute sovereignty of independence of health infrastructure in the health sector. Okay. And therefore, he must complete the Agenda 111 projects.
Nana, don't go yet. Dr. KATH Nawani is still with me. He's the chairman of the Health Committee. I understand that we just lost him there. We're trying to work the telephone lines and get him back on the line with us once again. Dr. Ayuafrie is still with me. He's the ranking member on the Health Committee. You've been talking about Agenda 111, some hospitals that the MPP you claim completed, and you are calling on the NDC to complete the remaining hospitals that are been left idle. Do you think that is a solution to the crisis we are facing?
So, for instance, in Ashanti region, you have the 95% completed in his equipment to just start operating. You have also that of the Kokobin, or Forikrom one also ready, just has to operate. And then already you have Sewea sitting there, all it needs is road, water, and electricity. Yet you have abandoned these ones and you've opened, you are constructing new ones at OT, you're doing new ones at Damango, and you are doing new ones at Western North. You see, the taxpayers' money has no distinction of whether it is a blue party or a green party. But what is good for OT and Western North and Damango is equally good for the people of Ashanti region. And that is why they need to fix the problem at Sewea. Sewea is 300-bed facility. And you need to get electricity, water, and light there. And you need to pay the remaining, I think, about 50 million cedis to the contractor. You've paid almost about 700 million. Left with 50 million. And then for 1.5 years, it is there because it's a political asset of the MPP. But then the one in Kumewu, which is just by my hometown, we are using it. It was done by the NMS and the NDC. And then you did it to about 50%. The MPP completed it. At this point, when you are using it, are you going to say MPP or NDC? Nobody cares about this. Now, when you did UGMC, phase 1, you needed 217 million to complete phase 2. Phase 2 was completed, funds sourced by the MPP, completed by the MPP. But as of now, when you go to UGMC, who cares about whether it is MPP or NDC? Nobody cares about it.
Right.
So the over-politicization of healthcare need to be unwinded. And this one, it stops right at the doorstep of the president. Because at the end of the day, you promised that you were going to make sure that you were going to execute all this. All the things in the health sector. There are a couple of things to be done. You promised nurses jobs, you are not able to do it. Laboratory jobs, you are not able to do it. Pharmacists are unemployed. The situation is so much painful and difficult. Again, with the hospitals, if you are able to complete them, it will give jobs to almost over the 60% of those unemployed ones at home. So why don't we tear down the political veil and then just look in the eyes of the issue and on the face of the issue, be sensitive to Ghanaians, and then be able to deliver on what we say. You see, that's where we are. And also, with these teaching hospitals, please, they need to put tents-like places as they do for those who are leaving for Hajj. Get those tents, get those beds, get ICU equipment in. You know, people can credit them to you. At least for Kolebu, Temale, Ho, Konfanoche, Cape Coast, you might have a place to improvise. That is the very short-term one. In the medium-term one, you try to execute the over 75% completed Agenda 11 projects. In the long-term one, you then be able to complete all of them. At the same time, you then go ahead with what you have done. The Ghana Medical Trust. The Ghana Medical Trust is supposed to take care of specialty care. If the president has all it takes, he has a great opportunity with this Ghana Medical Trust to take away provider payments and then focus on specialist care delivery. Look, he will leave a very fantastic legacy. The fact that MPP was not able to do this does not mean that the innovation by the president is well. However, getting a Ghana Medical Trust who are paying provider, who are competing with the NHIA in provider payment, it's wrong. Totally wrong. You understand? So if we want health sovereignty, just as the president is preaching, then he has all it takes now to put together the political promises of the NDC, package that of the MPP, from the free primary health care or from the primary health care with the Agenda 111, with the Ghana Medical Trust, and that is going to be a great legacy he's going to leave. But first, he must tear down the political lenses. You have to drop them. Drop them.
The performance of the health minister, Minta Kano, has been called into question. Some actually argue that he has been underwhelming so far. Is that a conclusion you agree with?
Because you have a challenge with in the health sector. Every health minister have had his fair share of challenges. Name one, and I will tell you what the person who went through. You understand? The health sector is a very sensitive institution. So no health minister will find it or have it easy. But then your temperaments will also have to be one a kind that appease and put people together. And if they are saying they are not happy with the way he storms the place and his approach to them, he must take it and then change. I don't think that this is the reasons why I will call for a sack on him, because really, what is happening, that has not happened before. Tell me one under NDC or under MPP, and I will tell you that it did happen. So I don't think there's a reason why I will be able to call for him. I must be objective with you. I do politics, but I'm not going to play politics for this, because really, what has happened that hasn't happened before.
Okay.
But I think the issue at stake is that Ghanaians and the doctors are saying that complete the Agenda 111 projects. The Seria Hospital is there, complete it. The Afari Hospital is there, complete it. Those around them are there, complete it.
Okay.
That's the statement. The closure of the place is just a major statement that government should apply the resources appropriately.
Right. You are a medical doctor yourself. Your colleagues are on strike simply in solidarity with the CEO.
But why is the chairman? The chairman is supposed to speak in on this, and then he's going.
Unfortunately, his line dropped. My producers are working the line.
You have to bring him back when you have strike and you run away. How would you walk through the situation properly?
He hasn't run away. We're trying to get him back.
Find him and bring him. Yeah, bring him back. Else my line could also drop. Yeah, I could also lose my life.
We're working the telephone lines.
Actually.
Yes, he's out of town when we called him, so his line is a bit. It's a bit problematic.
You go ahead.
You are a medical doctor yourself. Your colleague doctors and other health professionals are on strike in solidarity with the CEO. These are sensitive health workers who are not supposed to go on strike. In fact, we've been hearing from the CEO himself, who says that the medical doctors who have gone on strike in solidarity for him should return back to work. Shouldn't they return back to work? Do they even have to go on strike over this?
My brother, the workers have various tools at their disposal to also respond to servitude or whatever that they think is affecting their execution of their line of work. And so for me, in the historical context, you've had several strike actions based upon salary, based upon issues that borders on delivery of health care. And I'm not going to say that they've done anything that has not happened before. It has happened. And somebody will say déjà vu. But the issue at stake is what I'm saying, that yes, indeed, they wanted to draw attention. They wanted to drum home some issues, sensitive issues. They have. But ultimately, the Ghanaian must not have to feel it. And that's why we are asking that they should go to work. And this is one of the issues that they must be, the doctors have to show empathy. Why am I saying that? Based upon suspension of your CEO for a decision taken. If you drag this, look, my brother, if they drag this, they put Akwesi's job on the line. Please, look, please, let's talk reality.
Right.
If they drag this, they put his job on the line. That's why he's also pleading with them. So, yeah, I'm sensitive to the Ghanaian. We didn't lose power for me to think Ghanaians should die for who to go and vote for us to come back to power.
Right.
But as a doctor, I'm not trained like that. I will not think this way. I must be honest with you, and that is me. At this point, when we drag it, you put the very person you are solidarizing with job on the line. So I'm asking them that let's go back to work and then evolve the issues. We are all coming there. I've asked the chairman on the platform about 2 hours ago that we have to visit Akufo-Addo. Of course, the minority is also going to do what we have to do. We are also going to do our own thing. But the committee has worked together. I worked together with Akando.
Right.
To stop a strike action. Not 1, not 2, about 3 under MPP. I owe him a good 10. I must be honest with you. And I'm saying this in public, and I'll say it again. At that point, I engaged him. And then he was reasonable to me. I will show him that good faith on this occasion.
Okay.
And I'm asking the doctors, in all sincerity, for the sake of the Ghanaian, please go back to work, because we've all recognized your feeling.
Right.
And we are clear in our minds that you were right in your decision.
Dr. Nana Ayiwefrie, thank you very much for your time this afternoon. He's the ranking member on the Health Committee in Parliament. Let's stay a bit longer on health, because more than 4,000 residents, including students and healthcare workers in the Tano North municipality, now have access to clean water and improved sanitation, marking a major boost for public health and education in the Afo region. Well, this follows the official commissioning of the 2025-26 Wash Systems Strengthening Project at the Susuanho Roman Catholic Cluster of Schools. The initiative, implemented by the IRC Ghana with funding from the Church of Jesus Christ of Latter-day Saints, aims to bridge water and sanitation gaps in underserved communities. Emmanuel Edujemfi has more.
Local authorities Partners and community members gathered at Susanho to unveil the newly constructed water, sanitation and hygiene facilities. For many rural communities in Tano North, access to clean water has been a long-standing hurdle.
Enjoys access to quality water, sanitation and hygiene services. That is the Tano North we are building. That is the future we envision. And that is the development our people deserve. Today's commissioning is not only a celebration of a completed project, but also a testament to what strategic partnerships can achieve. It is my expectation that this collaboration will continue and expand.
The phase of the project has delivered critical infrastructure, including solar-powered water systems, gender-responsive sanitation facilities, and hand-washing stations.
Water and sanitation services will not be a privilege for a few, but will be a reality for everyone. And therefore, everything that we do is towards this goal, supporting local authorities with the capacity to be able to drive this agenda.
With these investments, the burden of accessing basic amenities is significantly reduced, paving the way for better public health and improved learning conditions in the municipality.
This project has been made possible through funds generated from the faithful payment of fast offering and humanitarian donation by the members of the Church of Jesus Christ of Latter-day Saints. This sacred contribution have been used to bless lives and improve the well-being of these communities. As beneficiaries of this project, we have a responsibility to protect and maintain it.
Beneficial institutions have been urged to use these wash facilities prudently to ensure value for money. Emmanuel Edujemfi, Joy News, Susanho, Tano North Municipality.
Away from health, demolition works have commenced within the Akufo-Addo municipality, particularly in Osu, where authorities are identifying at least 3 structurally weak sites for immediate action as part of efforts to avert possible disasters. The exercise has seen personnel from the National Disaster Management Organization, NAPMO, executives from the Akufo-Addo Assembly, the Ghana National Fire Service, and other emergency services on site. Engineer for the Akufo-Addo Municipal Assembly tells Joy News the affected structures pose safety risks and have been earmarked for demolition following assessments by city authorities. First, let's listen to some residents and occupants affected by the exercise.
Just impromptu. And actually, no, why kakra? Well, and no, not before the police for us. We are parking. You know, my unit is there, but maybe I'm not quite down any problem. And the minister, my last care was made a rented charter car. That's a minimum. I want to know what. Maybe I'm down there, need to me. What now? How many years? Oh, you have more than 30 years.
But also, a building in the
building there was on the side in my week. For 40 years, almost 60 years building. Well, and almost waiting now that waiting now the same. I need to work. No one will the same pattern. But I didn't know how to take off your life into so the employee. I'm about notice. I'm marking about more. I say 3 months time, 2 months time. And I want to say now. I'm say we are pretty. I'm make sure your man will. I'm compensate you here. Tenant to know you are you how better now one chair. Emma, it's we are two. You know, Baba later. Is a landlord no to when I realize I come and stand there, let's fall down. That's all. That's all people inside running house.
People they stay the house inside. How many people they stay the house inside? But then what you think say the cause the building making collapse?
The building is too long. Long time.
How many years?
30 years. Okay.
Building 30 years.
It's more than 30 years. But then the machine be not 50 something years, but not building like machine. More than 30 years.
Nyeke landlord ewi.
Landlord ewi kami ya. Wapo no yo beni ko no kami. It's more than 50 years. Wana kami ni mo pe. 200 something years.
Ni amelia keshi ine ke ijula. Ibahani amegwalo no ko.
Amelia ka bagbo isi. Ame sumoje ni. Me ba rent yo.
Here.
Oh, look at this. About renting.
Mina kasi shops mu yeshishi alo. Mina ho ye.
Those are some affected residents. Meanwhile, the engineer for the Korle-Klottey Municipal Assembly says 3 sites have so far been identified for demolition, with further inspections ongoing across the municipality.
We're putting up this structure down today, and let me say that we started somewhere last year, and we need to engage the family. First of all, we also have to prove that the structure is unsound, and thereafter we engage the family, and after engaging the family, then we realize that there is some misunderstanding between the families, and then we need to solve that. And after that, we also have to come to the structure. There are tenants in it. We need to get them out of the place, and then we disconnect. And today, we have the opportunity to bring it down because it is unsafe. As you can see, it is coming down from the top. The structure is actually coming down. And if you don't pull it down, anything can happen and we may lose life.
What defects have you identified with the structure?
So I have some of the videos with me right now. The columns are actually exploding. You realize that the rebars, the iron reinforcements are exploding. They corroding and thereafter exploding. And then you have the columns coming down. Some of the structural elements, talking about the beams, the floors, the columns, are totally coming down. And those are the elements that are holding the structure together. And the cladding elements are not so much, important. But the important thing is the structural elements, which are very defective. And so we need to bring it down. Otherwise, we'll have casualties.
How long is this operation going to take?
We expect it to come down by the close of today. If you're able to finish early, we'll go to the other sites. We have identified some of the sites, and thereafter we'll go there.
We can now take you to the site where the first building earmarked for demolition by NADMO and other security agencies has been brought down. My colleague Stephen Mensah has the details from Osu.
So we are bringing the trucks. We will clear this place to zero.
Okay. And you said you've also identified some 11 facilities in the Greater Accra region that are expected to demolish. Tell us more.
Sure. Yeah. So tomorrow we'll take a break, and then from Wednesday we'll continue. So we'll let you know where we'll be moving. We'll be moving to Wejagbawe. Yes. So tomorrow we have to send our guys there to check whether indeed everybody has moved from the structure, because there were some tenants. We've given them time to move, because that building is equally like this, but I think that one is just 1 story. But all the concrete plastering is peeling off. And then you can see that the slab has sagged in. Very dangerous. Walls are falling apart. So on Wednesday, we'll move in to go and do that work.
So if the rains had not exposed these buildings, would you have done that on your own?
We have done, I told you that we deal with 3 Ps. We have our preparedness activities that we do ahead of the rains. Well, we knew the season, and especially this year, we had early warning signals from GMET that the rains are going to start very early. So we also started preparing ahead of time. So this building, for instance, it was earmarked 3 months ago. So it's not because of the rains that we are putting it down. We have already done that. We did that for 1 month, moved out all the occupants, and then we brought in AESL to conduct the test to make sure that we are on the right path. And then we involve the landowners. Of course, this structure is not a waterway, so it means that it's a legal structure. So we just have to involve the landowners and let them know why we have to pull it down. And we all agree. So you can see there is no chaos here.
Those that are pulling down, are you evacuating them somewhere else?
No, they have to. We evacuate them. They have to find a place for themselves.
Don't you think the government must do something to support?
No, this is not a government issue. We are protecting their lives. That's why we give them enough time to look for an alternative residence. So this is not. We are not providing anything for them.
All right, thank you. Please turn around this way.
That was the Deputy Director, the Director General for the Greater Accra Director for the National Disaster Management Organization. And what you'd see currently will be that the 4-story building is down now. And you notice that efforts are being made to ensure that the excavator which brought down the building is safely down. But then the regional director for the National Disaster Management Organization, Dennis Nati, has been given an update as to the 16 structures in the capital which will be pulled down in the next few days or next few months. But then currently we are going to get closer to the Ghana National Fire Service here, who are giving an update also.
Did not get hurt. So as and when we are doing, these are some of the risk assessment that we do, so that we alert him that where you are heading towards, in no time the structure is going to come down, so that they could retreat and then ensure. So as it stands now, we are calling on our rescue team to come in to be able to ram and create some space for the excavator to be able to move back and then continue with the work that we began earlier this morning.
So clearly occupants were living on a time bomb, and they didn't know this.
Yes, it has been on and off. You know, some of us are too recalcitrant, and I think it is high time we enforce the laws. It's not as if Ghana, we don't have the laws. We have the laws which are very effective. So I think by and large we would enforce, and this is the beginning of the enforcement exercise. Apart from this building, 16 other structures have been earmarked for demolition, and we are going to do our best to ensure that we bring all such compromised structures down in order to avert any tragedy in the future.
You talk about doing your best in ensuring that some of these structures come down, but would you say that you have failed on your part in ensuring that some of these structures do not stay up?
You see, we will not say that we have failed. If we have failed, we wouldn't be here this morning, the whole of this morning, to ensure that this structure is being pulled down. And as a result, this is not the only structure that is compromised. You know, the rains are also bringing things up, and it is important that as an institution mandated to ensure public safety, we work hand in hand with our collaborating bodies to ensure that people's lives are safeguarded, and then such structures are pulled down to ensure that they do not lead to any fatalities as recorded in Adenta New Site, Aveno, and then Accra New Town.
How soon are we going to see this rubble cleared?
Yes, it's quite a difficult work, and therefore we wouldn't want to give any timelines, but we are sure that by close of day we should be able to bring the debris down, probably take away most of the debris, and to ensure that the place is deemed safe for passage of the public. So we'll do our best within the circumstance. If we are able to finish today, I mean, that will be a plus on our side, but if it goes beyond today, we would ensure that the place is kept safe and then nothing untoward happen.
Thank you so much, sir. So that was the public relations officer, the head of the public relations office of the Ghana National Fire Service, and he has been giving an update as to this building that just got down. There was a 4-story building and just got down some minutes ago. I'd want to get close to one of the engineers for the assembly, and he has been giving us an update off camera, but then we'll be getting your update. We spoke to one of the engineers for the assembly, and he tells us about some 16 structures that have to be pulled down. This one is down. Given that there's still debris, how long is it going to take for all this to be cleared?
So at the moment, as you can see, the excavator has a little issue, so they will try and rectify it. If not, we will have to request for a reinforcement to lift it out of there. Then we can now the major part is done, so the rest is maybe by 2-3 hours time. Yeah, and then there are trucks on their way coming, to pick up the debris. So,
in terms of safety, are we confident that no one is harmed by this?
No. That's the operator, the one in the brown or purple top. Yeah, so you can see it was successful. No casualties.
And what's going to be the next step for going forward?
Yeah, so going forward, like my boss mentioned earlier on, there are other ones that we are going to bring down. Yeah, so we are still on it, trying to make sure we don't have any casualties, especially in this season.
Right, thank you so much, sir. I didn't get your name.
I'm Anthony Kumasi.
Engineer Anthony Kumasi, and he's part of the Korle Klottey Assembly, and he's one of the engineers for the assembly. I just want to pick the thoughts of a member of the assembly, and he's an assemblyman. We spoke to him some minutes ago, close to an hour ago, before the building was brought down. Chief, finally the building has been brought down. Yes. The president has indicated that it's due to some negligence and indiscipline on the part of Ghanaians. But then I'd want to pick your thoughts. I do think as an assembly we are complicit in putting up some of these structures, leaving them up, building without permits. Do you think we are complicit in this?
No, see, this is not. It's about 60, 70 years building, and you can see how strong it is. But it's lack of maintenance that has caused it, as we saw it earlier. So if like you are putting up a high-rising buildings and we are taking good care of it, like maintaining it as and when, like we will not find it this way.
But then I want to understand, because we spoke to some of the residents and they say that this building has been here for a long time, and you've clearly corroborated the story. But then do you think as an assembly you have failed on your part in ensuring that this buildings, given that you've given these residents and the tenants and their landlord some notices and they failed to adhere to the notices, do you think you failed on as an assembly in ensuring that they moved out quickly?
See, sometimes you have to attach human face to it. So we keep warning them till today. Because we are the number of them went out from the building, left like 2 people, which was forcibly ejected, and the work has been done as at today.
Thank you so much, sir. So I want to get close to the MC for the Korle Klottey Assembly, and I believe she'll be giving us an update following the demolition of the 4-story building here in the assembly.
So we are dialoguing with a few of them. The 1 or 2 that want to do it today also. That's along the 28 February Road that leads to Labadi. There's one structure that is quite old. I think they use clay. So I was there this morning to tell the family members that probably by close of day we'll put the entire thing down, and then we'll clear the place and barricade it for the family. No, we need to keep on dialoguing with them, because Osu, we have a lot of old buildings, and it's difficult for someone to change the family house. We all understand what family houses are. So people don't want to move out. They want to live there. We've been to 3 or 4 places this morning just to encourage them to find a way. Once we break it, they'll get people to develop the land again. So that's what we are taking one at a time, and make sure that the municipality is cleared from these unwanted structures that may pose problems to us.
Do you have a budget for these people you're asking to move out? It might be an impromptu thing for them.
No, but no. We budget to support them. We as an assembly, we generate income. We seek to safety. So if they don't have money, and because of safety we have to take over, we'll do it. If we have investors that are coming to take over, that bill will be there for them. If you want to do it, before we grant you permit, there is what we call demolition fee that people pay. So they'll pay. When they pay, then they can develop the land. We don't have budget for them, but we have emergency funding that we'll use to do this work, and wait till we are paid back. And I'm sure we'll be able to collect our money. Once the land is there and needs to be developed, we'll get the feedback. But we need to do this to save lives and properties around.
Do you think as an assembly we are complicit in ensuring that these sites do not happen in the first place?
See, complicit is I don't know how to term it. For instance, you give somebody permit. There's a structure, drawings and things to you. You approve it. The person is building. Sometimes you don't always come probably to look at the mixture or things. But depending on how it happens, you may get these defects. And most buildings get defects, no matter what you do. So I won't say we are complacent. We do our work. Sometimes these things come up, and we need to deal with it as a municipal.
How is the fiscal department of your assembly going to be active from this time on, correct?
They are always active. In fact, when I came, I asked them to evaluate most of these buildings. They gave me the report that some of the buildings needs to be pulled down. They are doing their work. In fact, our planning committee is the most constituted because we abide by every rule of the act. We have everybody. We have from engineers, fire, we have integrity people. We have almost everybody, lands, everybody is there. So the committee is well constituted, and we do our work to ensure that the structures that they put up conform to all the rules and norms.
So we have the rains already in. Yeah. How prepared are you?
How prepared? I wouldn't get.
As an assembly, how prepared are you?
As an assembly, before the rain set in, we're doing our own dredging. You know, the filth, the silt in our gutters and the plastics, we need to desilt. We've done a lot of that, and that is why this time you could see that the Addo did not cause so much havoc. That's why we have almost every area getting some flood, but our own was minimized compared to other times that we've had flooding.
So Adabaka did you experience that as well?
Flooding they experience, but not as everybody will anticipate. You know, it does within 1-2 hours the water is receded. So we did our work before, but like I always keep on saying, flooding has to do with the length of downpour, how heavy it is. The water cannot move as fast as possible, but 1-2-3 hours it will all move. So flooding, we work at it, but then we can't say it won't happen. But we work
minimize the impact.
Yeah, the impact to try to minimize it. But something natural phenomenon. There's nothing we can do much about it. Okay.
Thank you so much. Sir.
Welcome.
Your name, sir?
Alfred Alutegezi, the MC for Koloko.
So, the MC for the Kwale Clothing Assembly also giving us an update as to what the Assembly is doing as in terms of preparedness for the rainy season which has already set in. He has also been talking about the fact that they are prepared for demolishing some of these structures, and these dilapidated structures, they say, are posing some safety risks to residents living in these communities and in this assembly. But so far, in terms of updates, we can give you the update that this building, which is close to the Osu Catholic Church, has been brought down, and currently the debris is getting ready to be collected. From the Kwale Clothing Assembly, I'm Stephen Benton.
Thanks for that update, Stephen. Let's bring in the Executive Secretary of the Structural Subdivision of Ghana Institution of Engineering, Prince KATH Avotri. Dr. Nanayao Akwada is a public safety advocate. Also joining this conversation is Niba Emmanuel Maxwell. He is the Director of Man-Made Disaster at NADMO. Gentlemen, thank you very much for your time this afternoon. Niba, I want to begin with you. In all, how many structures have you identified in Accra which have been earmarked for demolition, and why? Right, we're trying to get the experts to really understand the situation with the structural defects that we are witnessing across the country. And as my colleague Stephen Mensah brought you, some structures in Osu have had to be pulled down because of structural defects. We're trying to get their expert analysis. Let me bring in Dr. Nanayao Akwada, who is a public safety advocate. I believe you can hear me. Welcome to the program. Hello, Dr. Nanayao, can you hear me?
Yeah, I can hear you.
Right.
Good afternoon to your viewers, and good afternoon to you.
Thank you. Now, 3 Ghanaian lives have sadly been lost in the North Industrial Area building collapse. And this is not an isolated incident. In fact, over the past 15 or so years, we've seen several buildings collapse in the country. Yet, this pattern persists, and we continue to follow the same cycle. What really is the issue from a public safety expert? Let's understand it.
Well, thank you very much. And I think you provide a very accurate background to building collapses in Ghana. As a matter of fact, it's been over 15 years, right? As far back as 2009, when the Bureau of Public Safety, started tracking some of these public safety incidents. It is a matter of record that Ghana has one of the robust building codes in the sub-region. Okay, this is not a fact that is contested. I think about 4 or 5 years ago, our building code, the building regulations, was voted as one of the most robust, within the sub-region. But why do we experience such building collapses very, very frequently? And you can trace this to not a lack of laws, but a lack of enforcement, a lack of, not a lack of, but a poor oversight, within the development space. We have said that as a country, we have failed largely to hold people accountable, persons that we have placed in positions to ensure that these things are at least minimized, are failing on that mandate largely. And at the end of the day, we, the public, and as well as the public safety institutions themselves, they become the victims of such, incidents. So we at the Bureau of Public Safety have asked for, continuously, we have asked for reports from such incidents to be published so that as a country or as advocacy agencies, we are able to trace, value to some of these investigations. We want to know what was said in, say, the Melcom building collapse. What were the actions that were to be taken? Who were the ones who were to take those actions? What were the gaps in that, incident? How are we as a country, dealing with some of these things? If we fail to continually make these incident reports public, then we do not help ourselves, and we are also throwing away, the taxpayers' money into sponsoring some of these investigations.
And it appears that anytime these incidents happen, we go there, try to, find temporary relief. We leave it, wait till the following year, and nothing happens. What should we do to permanently ensure that these disasters do not recur every year?
Thank you. I wish I could share one magic wand that when we do it, boom, this thing is not going to happen again. But it appears to be systemic, okay? And for systemic issues, we need to be comprehensive in addressing them. First of all, who are the ones that are supposed to ensure that the building code is, adhered to? Second, for developers, what kinds of education are we giving them at the point when they start thinking of, such developments? When they come, where they interface with the regulatory agencies or the local authorities, what are they told? How are they advised? And then thirdly, the artisanal realm. How are we sanitizing the artisanal realm? How are we qualifying, say, electricians? I know that the Energy Commission, together with the Ghana Electricity Company, they have a system for qualifying these electricians. Does the public know? If you want to wire your house, do you know what you should look out for in, say, an electrician? but how are we qualifying masons? How do we have institutions that will say come in and test the concrete work of ordinary buildings? Do we know where to go when someone is building for us? Do we know where to go to say, hey, this is the standard cure that we must have in this, or this is the ratio that we must use for this level of, concrete, or for this rise of, floors? If the public do not know where to get these things addressed and where to get help for some of these things, we will continue to be chasing our tail. So it's a systemic something that we all as a people need to address. And then finally, the culture of accountability. It's very important. We have said that if, for instance, buildings going down in Accra is tied to persons in authority, and those persons are, dealt with, it's going to send a signal across the country that, look, if this is my space, I've got to roll up my sleeves and go out there and make sure that no one is building or putting up buildings without the requisite permits, the requisite oversight. Because if it comes down, I'm going to lose my job. As far as those things do not happen, and people rather get to award contracts, get NADMO supplies to go and supply, for which sometimes they divert some for their own personal gains, it becomes an incentive not to even do what they have to do. So I think that moving forward, these are the areas that we as a people need to look. And permit me to say, because I've said it already, but let me emphasize it, that it is absolutely important that when these disasters occur, when these collapses, explosions, market fires, etc. occur, and we spend the taxpayers' money to set up investigations committee, that report becomes a public document, and everyone must be able to access it, so that if even the state itself is not going to hold people accountable, we know who is supposed to do what in order to ensure that these things do not happen. And when they recur, we can call those persons out.
Right, don't go yet. Let me bring in Prince KATH Avotre, who is an engineer, structural engineer for that matter. Welcome to the program. What do you make of the timing of these demolitions that come just days after the recent collapse? Do you think NADMO and the authorities are really up to the task?
Yeah, good afternoon to your viewers. And that's a good question to start the conversation with. Yes, this time around, they've identified some structures, so it's a start. It's something that we should encourage. Because I had earlier spoken to some of your sister nations that I said by now all the assemblies and then the NADMO, the MMDCs, works departments and the engineers, they should start, if there are funds available, we should start assessing buildings that are 2 stories and above to check whether they have permits or not. If they don't have permits, there's a way to regularize it. We should get a structural integrity for all those buildings. And if it's fit for purpose, they can issue or they can give the opportunity to kind of get a permission to have those buildings done legally. Then once structural integrity is done on all these buildings,
all Africans across the continent and throughout the diaspora,
all these buildings it's like I have a feedback.
Right, you do. Try and work on that. Is it okay? You can take a moment to work on that, and let me continue.
No, I think I'm getting my feedback from your end, rather.
Oh, well, my crew is going to work on that, but while we wait, let's bring back Dr.
So if it's audible.
Yes,
yeah, so I'd like
very
to
audible, I can hear you.
So once we have these ones, the buildings that do not meet the threshold requirement for it to stand, I think the best thing to do is to get a demolition order and then bring them down. So we can avert some of these places that are around. And then the public education, like my earlier speaker said, needs to be done. The channels to put up infrastructure in this country needs to be enforced. We have wonderful laws, and then we need to have it. We need to have those things done.
Right. Don't go yet. Let me bring in Emmanuel Niba, who's the Director of Man-Made Disasters at NADMO. Welcome to the program, Emmanuel. In all, how many structures have you identified in Accra which are earmarked for demolition, and why? Kindly unmute your microphone so we can hear you. While we get Emmanuel to unmute, Dr. Akufo-Addo is also on the line. Let me bring him back. Doc, we've been hearing from key stakeholders. One of them is the MP for Buakwa South, who is calling for the establishment of a national disaster relief management fund to cushion victims of Accra's perennial flooding as we pursue long-term solutions to the crisis. Do you think this is a good call, really? A national perennial disaster relief management fund?
By all means, when these things happen, we will need to come in as a state to support, right? But should we set up a fund to address perennial challenges that we can easily go around it? My answer is no. It's largely, Accra's flooding issues is largely self-inflicted, and the research is out there. We were the first to put out the June 3rd fire flood disasters. After the committee's investigation and the state wouldn't release it, we did what we can to obtain a copy and we put it out there. And I encourage everyone to go out there and grab a copy on our page to read.
Right.
Everything the committee said were things within our control as a nation. Okay, we have just not committed ourselves to it to ensure that we minimize these floodings that occur perennially. You know, largely we all know, who in Accra don't know that the flooding in Accra is caused, number one, by failed, indiscriminate littering. Who in Ghana today does not know that the flooding that we experience mostly is caused by buildings and waterways.
Right.
So these are very well known. So instead of setting up funds to give people relief, we should go out there and do what must be done so that it does not occur.
Right.
We cannot throw monies at every problem every now and then when they come, like we've done in the last 20-something years. We did not get anything out of it. So we train problems at road crashes, we train problems at flooding, we train problems at we train money at market fires, literally throwing money at every problem that we face. That is not it. We are losing lives that we cannot recover. Those are the things that we should concern ourselves with. Because if the perennial flooding occurs and there is fund, of what benefit is money to me when I've lost my mom and my child? Of what benefit is that to me? Let's get to the root of the problem and resolve it.
In fact, I was actually shocked when I saw a video that has since gone viral on social media over the weekend. A man believed to be in his 60s dumping refuse in the rain, in the pouring rain. You can see him dumping heaps of refuse in the pouring rain. You believe that these are the issues that we should be dealing with, don't you?
Well, I have seen that video. I've seen about 2 of them. I was not shocked. I was not shocked because it's a common spectacle, right? What is happening is that the education is low, the enforcement is poorly low, and so people will do what makes them comfortable. That's how it's human nature.
Right.
If I know that I can take cocaine through our ports to a place where there is market and I'll be rich overnight, Why would I struggle every day getting up at 4 a.m., at 5 a.m., running through traffic to go and make peanuts when I know that I can just put a bag of cocaine on me and overnight I can sleep and be vacationing all over the place? It's human nature. So if we don't put in the system to address some of these behaviors, it will only continue happening, right? And that system to put in is not only putting in punitive corrective measures, but it's also building an ecosystem where we are also controlling how garbage is carted from people's homes to dump sites. Okay, how much are the companies that are supposed to pick garbage from people's homes to dump sites? How much are they charging? Right? If they're charging, we have to literally zone, like it's done in all civilized jurisdictions. Someone in East Legon may be paying 75 cedis a month for his literally boiler to be taken away. Should me, who lives at Tema site 21 or site 2, be paying 75 cedis a month for my rubbish to be taken away? We must have that income equity. It must be done equitably so that people can afford. You can't just say, well, you own this zone, charge whatever you can. I live at Community 12. At a point in time, the companies were increasing their fees every year without recourse to anybody, and there was nobody you could talk to. You either opt in or opt out. So if I opt out, where do I take my rubbish to? Where do I take my rubbish to? I call at best. If I don't wait for it to rain and then dump it in the drains, I call Aboboy, I give to Aboboy, I pay him 30 cedis, and then he goes there, dumps everything on the motorway or beside the motorway, or keeps it when it's raining. He just throws it. So it's a systematic thing that the people we are paying to run our spaces, our country, our systems, are not just doing what they have to do. And the problem is like they are overwhelmed by the problems and they are just throwing money at everything. And it's not working. We've been doing this for how long? How many years? It's not working. So we must bring ourselves to it and start addressing the problems as we have to.
You've ruled out the setting up of that relief fund that has been proposed by the MP. How then do we fund our disasters? Because disasters are bound to happen. It happens everywhere.
Look, instead of thinking about how to fund disasters, there's a reason why we set up NADMO, right? National Disaster Management. So the management of disasters begins from prevention. What have we done to prevent it? We only set up funds to address the ones that are really uncontrollable, like earthquakes, right? Like earthquakes. We can't say we are setting up money to take care of floods when Accra is not flood prone. We have made it a flood prone area. When we are allowing people to build, in Ramsey sites, when we are allowing people to build in waterways, when we are failing to control, littering. We can't set up a fund to say we want to set up a relief fund for that. Respectfully, it doesn't make sense, right? It doesn't make sense. If we were thinking of setting up a fund, we should set up a fund for actual disasters, like the sea breaking its banks and coming a tsunami.
Natural disasters, right?
Natural disasters, but not for ones that we have self-inflicted. It just doesn't make sense. Right? We should not. The next time we set up that fund, then I have to pay more for fuel. I have to pay more for petrol because we need some 1 cedi or 50 pesos on every liter to go into that fund. Are we not tired as a people? When we are paying people salaries, people are drawing salaries not to go to work. People are drawing salaries to sit down until buildings collapse. And when buildings collapse, they are not held accountable. People are drawing salaries to issue permits for people to build in waterways. People are drawing salaries using their offices to enable people to go and build in Ramsey sites. And we are getting flooded and we say we want to set up what. So I think that should not be in the discussion at all. Respectfully, forgive me if I'm raising my voice, but issues of national interest sometimes get this passionate, and I think we must all maintain a level head around this. We can't just say we should set up a fund just because we are having floods that we can control and we are failing to control.
Right. Don't go yet. Let me bring in Emmanuel Niba. He's the Director of Man-Made Disasters at NADMO. Emmanuel, can you hear me? Hello, Emmanuel, can you hear me? Right, unfortunately, we have lost Emmanuel on the line, but let's bring in Avotre, who is an engineer there. Engineer Avotre, do I have you with me?
Yes, I'm still here.
Right.
Let's run it up.
Right. It's quite interesting that this season, if you go to social media, it's all over. People say that they are witnessing floods for the very first time. People say they've lived in houses well over 15 years, 20 years that have never flooded before, but this season it is flooding. So what is the issue? Is it that it's raining too much this season? Or what really is causing new places that used to be flood-free, now flooding?
Yeah, so on the first note, I think in May, the Ghana Institute of Engineers have issued a policy in direction with regards to perennial flooding to the Minister of Works and Housing and Water Resources as well. And we were able to identify the reasons that you are asking for. So for a start, the low-lying areas of Accra is already saturated. We have a centralized stormwater drainage system with the traditional open drain systems that are around. And then we have the upstream area, which is catching up fast with urbanization, right from the Amasaman stretch, right from the Oyibi-Dodowa stretch, the Kaswa area, the top of Wager, those areas are fast developing. And these developing are uncontrolled. And for example, our spatial planning law tells us that every land that you buy, you want to develop, you should keep about 30 to 40 to 70% on paved. So what it means is that if I have 70 by 70 land, 35 by 35 should not be paved. By paved, I mean the building, including your car park area, should take about 50% only of the land. So that surface runoff that is captured on your roof of your infrastructure runs into your compound and gets time to infiltrate into the ground. Once this is compromised, every house in East Legon, every house in all these development areas are completely paved. The surface run water needs to flow downstream, which flows down to our existing drains that are equipped with silt and with refuse being dumped, and the whole system, and go through a cycle of flood. So these are some of the things. So if you want to really address some of these things, first of all, we need to start looking at the assemblies, empowering them as people. We need to start dealing with allowing for our nature way of draining rains and surface waters in our various compounds and our various areas. So these are a few things I could say for a start.
Right. Yes, we've seen NADMO earmarking some structures for demolition, but others argue that people have to pay for this. Do you think that engineers who okay some of these structures, people who sell these lands to people to build in waterways, and people who decide to build at places that they know are unsafe should be held to account?
So I think we need to put it in the right perspective. For all the collapses I've seen this year, personally as a member or part of leadership of the structural subgroup, it was for a fact that these buildings or infrastructures were not engineered. They didn't have permits.
Right.
And that's for a fact. Now, to talk about those that are somehow engineered and find these ways in Ramsey sites, like my previous doctor have said, we need to hold people responsible. If a Ramsey site is a protected area, a low-lying area, that helps all of us as a country to be rid of flood, and a few individuals grant permits and structures appears or at those places and we have to pay for it, I think people need to be held responsible. So for a start, anytime we go on situations like that happen, we always want to ascertain whether any of our members have really engineered this. Then it helps us be able to match as to whether material we use are substandard to whatever the engineer have provided. But if it's non-existent and you see substandard materials and other stuff, then it becomes problematic.
Right. That's quite interesting there. Now that we're hearing from an MP say that there should be a setup of a fund, a sort of relief fund for flood victims. I want to pick your thought on that as well. Dr. Akoda was not in support of it. Are you in support of the setting up of a fund, a relief fund sort of, to help flood victims in these times?
Well, to help flood victims in this time is anything that's caused them as welcome. But for it to be the main purpose for solving our flood problems, that I have to agree with the good doctor with all the presentations that he's made. I think we should deal with the problem, and then there are solutions to it. There are policies on our website. We do have the policies that were, I think, issued to the ministry as in clear direction on every part of our society, the role all of us have to play, right from the ministries, right from policymakers, right from all of us as individuals, how we can go back and look at the upstream management plan and have a decentralized flooding system, how we can deal with some of these things before it flows down.
Right.
So there are clearly engineering solutions for this that we need to put our energy and put our resources towards.
There are those who are also arguing that these buildings, most of them that are earmarked for demolition, can't something be done to them to be saved? Can they be renovated? Something like that for them to be saved? It's not possible?
Yes. No, it's possible. That's why when I started with my introduction with Matt, I was like, in Accra, I can say maybe over 50% of buildings are not in permit or they are not in bush. They've been there for a period of time.
Right.
And some of them don't have the requisite legal document to it. So what I was proposing is that we look at we have to assess this building. By assessment, it means that we do a structural integrity. An engineer, a professional engineer, or a built environment expert is looked at to assess these buildings. If it can be remedied, the person will provide clear solutions and processes that those buildings can be remedied, so that we can have all this building retroactively permitted and we can have it safeguarded. Those that cannot be saved, the professional engineers will be able to determine that this building cannot be saved, so they recommend a demolition of it. So this is not a hook line that you say, oh, if a building is 50 years or 40 years, it should come down. That's not what we are advocating for. Right. We are just saying that it needs to be assessed. If it can be remedied, there are solutions we remedy and we keep them. If it cannot be remedied, it should be broken down.
Don't go yet. Let me try one last time to connect with Emmanuel Niba, who is the Director of Man-Made Disasters at NADMO. Emmanuel, can I hear you? Say hello.
Yeah, hello. Can you hear me now?
Thank goodness I can. In all, I want to find out from you, how many structures have you identified in Accra which have been earmarked for demolition? And tell us the reason.
So right now we've identified about 16 housing buildings that are unfit for habitation by citizens because of the structural effects of those buildings, the siting of those buildings, and other issues that make those buildings unfit for people to live in. And so we have earmarked them. We've gotten the approval from the ministry. And then we'll be taking up the necessary actions to be able to bring these buildings out. Currently, we are working on to get habitants to evacuate these buildings, and so that we'll be able to bring them down to ensure that life and properties are saved.
And where are these buildings concentrated?
They are located, basically, some of them are buildings that are very old, and they are scattered across the capital town. They are in Tema, they are in Osu and Hachu. So these are the areas, Tema and Hachu, that is where most of them are concentrated currently.
What type of buildings are they? Commercial, residential, story buildings, high-rise buildings? What are they?
The number, basically most of them are commercial and houses that are occupied by individuals, and they are story buildings, a number of them, and that gives exposure. The exposure is high because they are harboring a number of people that are living in them. And so we think that the right thing to do is to bring these houses down so that we do not incur costs of saving actions that lives would have been lost when we need to protect lives now.
And when did NADMO become aware of these buildings?
So before this year, we have started this long ago. You saw us in Akufo-Addo that a number of houses that were not properly located were pulled down. But it takes a lot of time to deal with. So in the beginning of the year, we started identifying these houses. We've pulled a number of them down, and so it is a continued action, just that it has merged up with a period where a number of those buildings have been collapsed. And so you might think that we are starting it because it has collapsed, but we started these actions earlier before the rain set in.
And what's the average age of these buildings?
Some of them are freshly new buildings, and that have to be brought down, especially in Akufo-Addo. We did pull down a number of houses. One, they are not legally located in the areas that they are supposed to be there. They are found in waterways. We pull them down. And some of them are very old and the structure is weak. And so those ones will also have to go down. Some of them are poorly constructed. And so you see the integrity of the building is not good for habitation. And so they are being earmarked. So there's a number of reasons that account for this identification.
15,000, that's a huge figure. And how many have you been able to pull down so far?
16, not 16,000, 16, 1/6.
16,000?
Not 1,000, 16, 1/6.
That's the number of buildings you've been able to bring down?
No, 15 is identified now, but we brought down a number of them already. But 1/5 of them is a number that is also being worked on now.
Right, and how many have you brought down so far?
So far, I haven't taken a total count of it.
Okay.
We have different departments that are working on it with the inspectorate department. But if you monitor the media space, we have pulled down a number of those houses now.
There are concerns that this demolition exercise is a reactionary measure and not based on any proper research. There are those who are saying that some of these buildings could actually be saved. They could be saved by giving proper direction as to the way to go. Have you assessed any of these properties which you think are savable?
So before these houses are identified, we deal with institutions that are accredited to test the integrity of these buildings. We deal with the assemblies, the MMDAs that are also part of these buildings. We ensure that they are properly cited. If they are not, do they have the right documentation? Are the buildings habitable for human or whatever? We do this with the appropriate agencies, and so we are sure that the proper thing is being done. And when it's being identified, the processes, we activate the processes of getting the proper thing being done. The individuals in the houses are informed to leave those facilities, and then we put up the necessary measures to ensure that these buildings are being brought down. It's corded, and the area is ensured that pulling it down will not have other effects on adjoining houses before the exercise is being done. And we are working with the military, who are expertise in bringing these buildings down so that we don't create other disasters as we attempt to stop.
There have been calls for the creation of a national disaster relief management fund to cater for affected victims in times like these. Is this something that is welcomed by NADMO?
Very much welcome. I think our Director General is very much on it. And we are going to use your media to call on all agencies that can support us with our relief support programs, to be able to support people. The numbers are increasing, and that is having a toll on our budget. If you look at even evacuating people in their houses, it is good if we can provide them some support, be able to relocate or wherever they are living. But these are becoming so challenging to us, and so we want to appeal to the public and agency and institutions to come to our aid. Recently, Stanbic Bank was with us to provide a number of items to support our relief effort. And so we want to call on more agencies come to our aid. You can arrange some support for us as a social corporate responsibility. But of course, with the fund, it's a very huge happen, and that will help us to fight disasters.
Right. It appears that all the buildings that have been earmarked for demolition are located within the Greater Accra Region enclave. How about other regions? Are there some structures in other regions that NADMO has identified that you think should be brought down as well?
So, as I told you, it's an ongoing work. We are working in other regions, and we are identifying properties. Once we are done with it, we will issue a communication on it through our ministry. But of course, Greater Accra is of a reason. We have told you earlier in the year that this year there's going to be a lot of rain. There was going to be a lot of volumes of flooding across. And so the effect is high. The risk levels have increased. And so we need to start with where the risk is high. And that is why we are starting with Greater Accra.
We saw even just today you bringing down some structures in Osu, and then of course there are people who occupy those structures. What becomes of them?
So they are being informed to identify areas that they could live. Some of them could live with family members for the meantime. But of course, we are also preparing to support some of them to be able to mitigate the effect of what it is. But you agree with me, living there is not an option, because we will all be responsible if we allow them to live there and the building collapse on them. So the first thing to do is to get them out there and be alive, and then the other subsequent actions will be taken to mitigate the effect of what is happening.
You told me that some of the buildings that you are earmarking to pull down are even fresh buildings. Are all the structures completed structures, or there are some which are yet to be complete, but still you think that you have to pull them down?
Some of the buildings are occupying waterways.
Right.
And so the compounding effect of those locations is what is known to us, that it will increase flooding in those areas. They need to be brought down. Some are occupied, but then the integrity of it is not very good. It's unsafe for them to live in, and so we want to save life, and so we need these buildings to come down. So there's a number of issues that informed the decision, but majority of it is that they are unsafe for human habitation.
Right. Grateful for your time this afternoon, Emmanuel Neba, who is with the NADMO there. We've also been hearing from Dr. Akoda and also Prince Avotri, who is an engineer. Well, let's just stay on disaster, because the death toll in the North Kaneshie building collapse incident has risen to 3. The 3-story building under construction came down early Sunday morning, trapping some people. Rescue operations uncovered 4 persons from the rubble, including a woman, with 2 persons declared dead on Sunday. News coming in the last couple of hours is that one of the 2 people receiving treatment has sadly passed away. My colleague Adobe Asare went back to the site this morning and has just returned with the latest.
Twisted metals at the collapsed building site in Aveno. Sniffer dogs were deployed to search for signs of life beneath the rubble as rescuers looked for a woman and a child believed to have been trapped under the debris. Earlier, the lifeless body of a man was recovered, while 2 injured survivors were rescued. Many at the scene held on to hope that the missing woman would be found alive, but those hopes were dashed when a body was eventually retrieved from the rubble. Eyewitness Joseph Bereke said he heard a loud crash moments before the building came down.
I was in the store, the pillar don't break. As I look, I don't see the one boy called Wisdom in the waka they call. I was saying, thank God. I miss now this thing son I give Oga, so it happened. The next thing my guy, as they look at my guy, I think they collapse, come boom. We go go inside. See your surprise, they show my body. I got your saving, God save me, bros. God that saved me. He said, no, nothing wrong, go like this.
The collapsed structure also fell onto a nearby electricity transformer, causing significant damage. According to Charles Bigonu of the Electricity Company of Ghana's Operations Unit, The incident disrupted power supply to 1,000 residents in the area.
Yes, ECG, this is one feeder, a transformer is off. The accident that happened, this transformer purposely because of this our transformer or anything, that is why we leave space when you are putting on your building. You understand? So I would say they closed our transformer. The transformer was there before they are building.
Really?
Yes. The regulation are there. We inform him.
That's the owner of the building. You informed him that his structure was too close to your transformer.
Yes, sir.
Interior Minister Mohamed Mubarak Muntaka, who was also at the scene, said anyone found to have contributed to the collapse through negligence or wrongdoing would be held accountable. He further urged metropolitan, municipal and district chief executives as well as local government authorities to strictly enforce building regulations to help prevent similar disasters.
But we want to assure you that this cannot go unpunished. There are things that are natural. The natural one, we have to take care of it. Look at the iron rods that are used. Look at even the quality of the concrete. We want to appeal to the disassemblies. They need to be up and doing. Currently, NADMO has identified about 16 buildings within the Greater Accra region that has to come down. Get all those buildings down. We are currently doing the evacuations and they must bring all those buildings down. We empower the National Disaster Management Organization and the 48th Engineers Regiment to assist in bringing most of these buildings down before they cause these unnecessary deaths. But the permit to build always comes from the assembly. So we want the assemblies and their engineers to be up and doing so that we can support them to make sure that we have a very safe environment.
Greater Accra Regional Fire Commander ACFO2 Rashid Kwame Nisao described the incident as a wake-up call for authorities to tighten regulations governing building permits and construction monitoring.
No, I think that this is a wake-up call. This is a wake-up call because it's becoming one too many, so that the authorities that are concerned about structures should actually come in and help the situation. Where, in fact, I think the assembly plays a critical role here because permitting, all the permits emanate from the assembly. Okay. Most permits emanate from what? The assembly.
Vice President Professor Nana Jane Opoku-Agyeman, who toured the scene, reiterated the need for strict compliance with building regulations and safety standards to safeguard lives and property.
It depends on all of us. I want to plead with all of us to abide by the rules of siting property, of siting even our own houses. We know the place is prone to flooding. We know that this is a waterway. Let's not invite unnecessary tragedy. There are many things we can all prevent. And it's about doing the right things. We know them.
That's Maxwell Agbaba's report. You're still watching The Pause. We'll return from the break with more. See you in a moment. Hello again. Joy News Fact Check has shown that Speaker Alban Bagbin's claim the Parliament did not suspend Order 1721 before passing the anti-LGBTQ bill is false. The Speaker, in his former communication to the House on Tuesday on the passage of the anti-LGBTQ bill, said the House did not suspend Order 1721 before proceeding with third reading and passage of the bill. Record of proceedings from the Friday proceedings, however, ran contrary to the claims. The following report has details.
The Speaker of Parliament, Alban Bagbin, in his former communication to the House on Tuesday, 2nd June 2026, on the passage of the Human Sexual Rights and Family Values Bill 2025, also known as the Anti-LGBTQ Plus Bill, claimed that the House did not suspend Order 1721 of the Standing Orders of Parliament before proceeding with third reading and passage of the bill.
Order 172 sub Order 1 also states that, and I quote, where a bill has passed through the consideration stage, the third reading shall not be taken until at least one sitting day has elapsed, unquote. Honorable members, while the House possesses the power under Order 3 to suspend any standing order with the leave of the House, it did not do so this time.
The record of proceeding of Friday, May 29, 2026, however, does not support this claim. After the last consideration with respect to the long title of the bill, the presiding speaker, Bernard Ahiafo, announced an end to the consideration stage of the bill. The majority leader, Mahama Yariga, rose to his feet and called on Speaker to take item 41 on the order paper, which was a motion for suspension of the order 1721.
Majority Leader.
Mr. Speaker, we will take item 41.
Yeah, UCC. One.
Speaker.
Very well. Item 41. Wait. Motion.
Speaker, I rise to move that notwithstanding the provision of Order 172, Rule 1 of the standing orders, which requires that when a bill has passed through the consideration stage, the third reading thereof shall not be taken until at least one sitting day has elapsed. The motion for the third reading of the Human Sexual Rights and Family Values Bill 2025 may be moved today. Mr. Speaker, I so moved.
Honourable members, motion ably moved. Any seconder?
I rise to second the motion.
Honourable members, motion moved and seconded. It is for the consideration of the House. This being a procedural motion, I'll put a question. As many as are in favour say aye. Aye. Those against say no. Honourable members, definitely the ayes have it. The motion is carried.
This allowed for the House to proceed with a third reading of the bill and subsequent passage on the same day. It is clear, in the face of this record, that the House suspended Order 1721 of the Standing Orders of Parliament before passing the anti-LGBTQI+ bill on that Friday. Speaker Alban Bagby's claim is therefore false. Already, leading members on the side of the majority, including the majority leader Mahama Yariga and co-sponsor of the bill, Samuel Nate George, have indicated their rejection of the appeal from the Speaker to reconsider the bill for a second passage. James Saveji, Joy News.
Well, government left nearly 24 billion Ghana cedis of its first quarter budget unspent, despite collecting tens of billions of cedis in revenue, raising fresh questions about government spending priorities. At a time, key sectors are demanding more resources. Fresh Finance Ministry data analyzed by Joy News Research shows government revenue for the period also fell short by almost 3 billion cedis, while transfers to critical funds, including financing to the NHIS fund, for instance, declined by nearly 60% compared to budget expectations. The finance came amid a growing public disagreement between the Ministries of Finance and Food and Agriculture over the release of funds. Well, the Finance Ministry claims it has released more than 80% of the Agric Ministry's allocation for goods, services and capital expenditure, but the Agric Ministry strongly disputed the claim, describing it as inaccurate and not reflective of actual releases received. Listen to Deputy Finance Minister Thomas Ampim making the claim.
We are matching our vision for the sector with sustained funding. I'm happy to confirm that we have released about 1.67 billion cedis, representing 85% of the approved 2026 budget for goods and services and CAPEX for the Ministry of Food and Agriculture. And of this, the Ministry of Finance has released 521 million cedis to be invested in the 50 farmer service centers to support mechanization and improve productivity. We have released 110 million to be invested in irrigation infrastructure across country. We have released 515.3 million cedis for the supply of fertilizers and certified seeds to our farmers. 244.9 million to be invested in the poultry farm to table project, what we call the Nkopong initiative, and 200 million Ghana cedis to be invested by the National Buffer Stock Company to address the long-standing challenges in distribution and trading of produce. And the World Bank.
And the data and research analyst at Joy News, Anthony Menu, has been providing some details.
The Finance Ministry's data for the first quarter of 2026 actually paint a picture of both a spending slowdown and a revenue underperformance, which could have significant implications for the budget execution as well as the sector financing. Now, the government actually spent some 65.97 billion out of a programmed 89 billion, leaving a substantial 24 billion actually not spent, representing about 27% of the quarterly budget. On the revenue side, the state actually collected some 57.5 billion against a target of 60 billion, and this actually created a 2.7 billion revenue shortfall, which was largely driven by weaker than expected tax revenue from the AE sector, MFR.
Well, Anthony, before we go to the sector that probably got the shortfall, somebody watching me may be confused. If the government didn't spend, would that not be a good thing, though? What's the challenge with that?
So the challenge is that if you would remember the argument that is actually going on between the Ministry of Finance as well as the Ministry of Agriculture, we have some expenditure like the school feeding program, which actually, according to the data in the first quarter, did not receive any spending. So if you have such a social benefit not receiving the allocation that the government has actually giving to them, I mean, MFR, you would actually know the implication it is going to have on the schools as well.
Right, that's quite clear. So which sector really experienced a shortfall during the first quarter?
Yeah, so MFR, capital expenditure was actually the aspect or the sector that actually received a very hard hit with only 7.3 billion spent out of the 12 billion that was allocated for them, leaving some 41.9% shortfall. Debt servicing also underperformed. Government actually repaid 3 billion out of the 8.8 billion principal target, while interest payments were also 4.5 billion below the plan, with external obligation being the most affected. I mean, this someone will argue it may be as a result of exchange rate, but if you compare the exchange rate as of the end of last year to the first quarter of this year, we didn't really see much change. So that argument could really be some sort to argue. Also, we have transfers from statutory funds that were actually reduced with 12.3 billion released instead of some 15 billion. MFR, so if you look at the operational spending, goods and services spending fell by 35.5% below a target. And as I actually indicated earlier, some social benefits recorded no spending. And if you give me time to list them, we have the Lifeline consumer spending. Also, we have the Ghana school feeding program, as well as the employee assistance program. All of these, there were no spending allocation for them as of the first quarter. If you look at the revenue side as well, taxes on goods and services were down by some 2.6 billion, with VAT alone recording some 800 million gap.
Ghana and Belarus have signed 4 memoranda of understanding which will, among other things, deepen cooperation between the two countries in the areas of agric and other sectors. Earlier, President John Mahama held bilateral talks with his Belarusian counterpart, while the president, who is in that country, is wrapping up his 5-day official visit to Belarus at the invitation of the president will later today address a Ghana-Belarus business forum. President Mahama, in his speech, said beyond agric, Ghana sees immense opportunities for cooperation in manufacturing, pharmaceuticals and mining support services. He says Ghana also wants to see cooperation in transport and logistics, technical and vocational education, renewable energy and industrial development.
I'm particularly pleased that this visit has resulted in the signing of important bilateral agreements in the form of 3 memoranda of understanding. One, governing a joint commission on cooperation in trade and economy, and the second, cooperation of our chambers of commerce, and the third, cooperation in the area of agriculture. These MOUs represent more than just diplomatic achievements. They will establish the practical framework for our governments, institutions, and private sector to collaborate more effectively. They will facilitate greater exchange between our people. They will reduce barriers to official engagements, promote trade and investment, and create new opportunities for economic growth and technological cooperation. Your Excellency, agriculture remains at the center of Ghana's development agenda. Our vision is not merely to increase production, but to transform agriculture into a modern, technology-driven sector that creates jobs, supports industrialization, strengthens food security, and improves livelihoods of our people across rural communities. We're therefore implementing policies to increase productivity, expand irrigation, reduce post-harvest losses, promote agro-processing, and enhance value addition across the agricultural value chains. In pursuing these goals, we see significant opportunities for collaboration with Belarus. Belarus has built an impressive reputation in agricultural mechanization, in farm technology, equipment manufacturing, and agricultural research. These are areas where Ghana can benefit greatly through strategic partnerships, technology transfer, skills development, and investment. By combining Ghana's agricultural potential with Belarusian expertise and innovation, we can create partnerships that contribute to food security, industrial growth, and shared prosperity. Beyond agriculture, we see immense opportunities for cooperation in manufacturing, in pharmaceuticals, in mining support services, and I'm happy to announce that we already invited and will receive a delegation from Belarus to visit Ghana's mining industry and explore areas of cooperation. We also want to see cooperation in transport and logistics, technical and vocational education, renewable energy, and industrial development. Ghana positions itself as a preferred investment destination in West Africa. Our strategic location, stability, improved infrastructure, youthful population, and expanding regional markets create attractive opportunities for international partners. Through initiatives such as our economic transformation agenda and export-led industrial program, we're creating an environment that supports enterprise innovation and long-term investment. We therefore welcome greater engagement.
Away from Belarus, for years, the people of Wa have waited to see the redevelopment of the 500-year-old Wanes Palace. Promises were made, but little progress followed. Now that wait may finally be over. Speaker of Parliament Alban Bagbin has catch sword for the first phase of the palace redevelopment project, with construction already underway. Speaking at the ceremony, Speaker Bagbin said the project is not about him, but about preserving the heritage of the Wala Kingdom and creating opportunities for future generations. Joy News' Upper West Regional Correspondent Rafiq Salam has more.
In Wa, they have heard promises before. But on Saturday, Speaker Alban Sumana Kingsford Bagwin came with sleeves rolled up and a contractor already on site. No paperwork, no more waiting, just action.
This is not my project. I'm not going to be the contractor.
I'm not going to be the mason. I'm not going to draw the water. I'm not going to pay for all the costs. It's all of us who put our hands together to make sure that this is done.
He calls it a transgenerational act, something his great-great-grandchildren will point to and say, they built that for us. The 500-year-old One-House Palace is getting its first facelift since the 1920s. But don't worry about the history. Speaker Babin says the new design protects the original Sudanese architecture and meets UNESCO standards. That line drew cheers.
At the conceptualization stage of this project, some people also expressed legitimate fears that the work would deface the original architecture of this palace. Far from it. Bearing in mind the historical and socio-economic significance of this palace, the current construction will not demolish or vary the original Sudanese architecture.
Speaker Babin was firing back at critics down south who mocked the north as Zongo.
And you are not happy about it. So those of you who are trying to turn the town that earned first in cleanliness in this country over many years, you are turning it into an unrecognized Zongo. Please, get your loins. I'm prepared to assist us to turn it into an attractive and welcoming city.
But he wasn't done hitting back. He also took on those who have spread lies about his past, claims that he wasn't a good lawyer, for that never showed up in court.
Those of you who have been told that I've never been to court, tell the person telling you that he was not born then. I was a prosperous legal practitioner in Accra, the only person from the north that time practicing in Accra. I was the only one.
His speech to investors, simple, treat them like unexpected guests.
We must roll out the red carpet for investors who come to our region.
Before the groundbreaking, Speaker Alban Babin team toured all 11 municipalities and districts. He says unity is key because conflict, in his words, is a scarecrow that drives away investors. But the most powerful moment,
I want once again to caution against disputes, because disputes could mar the progress of this beautiful project. It won't stop it, but it could mar the progress.
But the most powerful moment came from the palace itself. The One-House Secretary, Jimpena Kadir Ibrahim, admitted they were almost speechless. The overlord of the Water State, now Hussein the City People the Fourth, thanks Speaker Babin, who also doubles as the chief of Dakar, for what he called an unwavering and unparalleled commitment from the Sherpa Corps to the new regional flag.
His Majesty's gesture that implied that the whole Wala State has been speechless when it comes to acknowledging the contribution of now Right Honorable Speaker to the development of the Upper West region and beyond.
If all goes to plan, this hall will be ready by Dumba Festival. For Wa is more than a building. It is pride, it is heritage, and it is a signal the North is open for business. Reporting for the news, Rafiq Salam. Wa.
That's it for the pulse this evening. For more news, you can log on to myjoyonline.com. The news team returns at 7 p.m. with News Prime. My name is Kenneth. Jesse, have a good evening.